Did it happen again? Your back got busted and you are in pain. Have you been sitting behind the desk for too long? Or did you overexercise or use wrong posture while exercising? Or maybe you were lifting something and didn't pay attention if you were using proper techniques. No matter what the reason, you are suffering now and your back hurts. You went to your doctor, but all you got was a pain prescription that helps with the symptom, but not with the cause. Soon your problem returns. What's the solution then? Should you ask for more pain medications? Have you considered alternative methods for your back pain? Such as chiropractor. You say you are afraid of the chiropractor. You heard those scary stories of loud body cracking, and you are now afraid to give it a try. Let's have a look how a real chiropractic session looks like.
So, Angela, how long have you been having low back pain and pain down your leg, please?
Probably since February.
February of this year?
Yes.
Yes. Is it going down the right leg or the left leg?
Left.
The left leg, yeah.
Yes.
Yeah. And so this is Angela's, 10th or so visit, right?
Right.
Yeah. And you see all the successful things we do. Not always is it a smooth, linear progression to getting better. And so some of the analogies I give people, it's like walking up the steps of improvement. We'll improve 3 steps to the good, but occasionally we'll drop back a step or 2.
Yes.
And then when you drop back a step or 2, it could be as insidious as just sleeping the wrong way or sitting too long, right? Yeah. So the last time I saw Angela was yesterday,
Yes.
and she was standing straight up and down. The leg pain had quieted down a little bit, right?
Yes.
Right? And so when you left here, how did you feel?
I was fine.
Fine.
But then later in the evening, this part of my leg started up again.
It started barking at you again,
Yes.
right? And so what did you do when you left here?
When I left here, I went home and just went about. I was okay after I left.
Right.
Then I got better.
Sure.
It was okay. Then last night I went, walked the dog, and came back in. And then all of a sudden I start feeling it again, and then it'll just disappear.
Yes. So what exercises do we give you to do on your own at home? Was it bending forward?
The ones that you bend forward,
Sitting in a chair, right?
sitting in the chair.
Yes.
And then I do the ones where this goes back. And
Right.
That one. And
So what we did was when she
and
first came in, we gave her some exercises to do at home to control the pain, and
Right.
they I think we started with, they're called Mackenzie, who's a brilliant physical therapist. So were you lying on your back and you were bringing both knees up to your chest?
Yes, I've done that one
you've done
too.
that. And you sit in a chair
Sit in a chair and do those.
So after you walk the dog and was starting to talk to you again, I was going to say it started barking at you, but no pun intended.
Yeah.
Did you sit down and do the Mackenzie exercise where you sit in a chair and bend your chest forward?
No, I didn't. I just kind of walked around, and then
Okay.
it kind of goes away.
This way.
I don't know if it's a way I turn
Sure.
that shoots, sets it off. Something sets it off.
Right. And it can
And
be
then
as little as just walking the dog. But what I want to share with you is when that happens, I want you to find a chair or
Okay.
find a flat surface and go through the progression of bringing both knees up to your chest 10 times,
Okay.
rest a minute 10 times, and gauge how that makes you feel. Are you better, same, or worse?
Okay.
Better, same, keep going. If it's worse, if it's not too bad, do it again. But if it's second set, if it becomes worse, don't do that particular position.
Okay.
Go to the chair and try 10 exercises. See how you feel. 10 more exercises. I want you to do those exercises when it starts
When
when it's
okay.
barking at you, right? Okay.
Okay.
So not the ones with your legs going. What she was referring to is she was doing so well. We progressed from Mackenzie. We started to give her low back core stabilization exercises we do, and she's should be doing both of those at home. So I'm learning something about what her thought process is when you get when it gets bad. You want to do those exercises, okay?
Okay.
And don't be afraid to put ice on it too.
Oh, okay.
All right. So let's have you go ahead and face Liam, all right? And now lean, or actually you face me.
Okay.
Liam, you come behind me a little bit. So you can see that Angela's kind of leaning a little bit to the port side, or actually the starboard side to her right side. Lean to the right side for me like we normally do, yeah? Does that bother you at all right there?
A little bit,
Yeah.
just a little.
Where do you feel it, please?
Right here.
Right in there. Now let's have you stand up and lean back this way. Yep. And what about that one?
There, it's coming here.
So it's a little...
It's worse. This
when you bend
feels
to the left,
worse.
it increases the symptoms going down your legs.
Yes.
Okay, all right. So what we've been doing is, treatment-wise, we're doing traction, decompression, right? Right. And in addition to the adjustments, and we started doing some active release on your psoas on that one side. So we're going to start there. Okay.
Okay.
We're going to do the psoas, then I'm going to adjust you. All right.
Okay.
So Angela, if you lie your side, face this wall, face Liam. Okay. Liam, has anyone ever seen you on video before? They know who you are?
Yeah, we did a live stream once.
You did? That's awesome. That's awesome. Steph, can you help me back here, please? So your son comes, right?
Yes. He's the one with the bolts.
Yep. Lean in there for me. He's a little bit more complicated. He's
He
been
is?
a few more things than you have, hasn't he? So we're going to do our psoas, okay?
I haven't done that with you yet.
You haven't. So have you done it with Dr. Blake at
I've
all?
done it with all the other ones.
Yeah, so what we're going to do is we're going to, it's not here, but I'll show you where it is in the next room. So we're going to release our psoas, okay? So Angie, I'm going to come in here like this. Where's your belly button hiding on me? There it is. So,
Bring this knee up just a little.
yeah, go into flexion a little bit. Yeah,
There you go.
good, yeah. So now go ahead, take her back into extension. Yeah, you can see she's trained already. I don't have to cue her already. Drop that knee down a little bit towards the floor. Yeah, very good. Come on back up again. So I was down in the locker room with the Orioles, and the athletic trainers are really amazing for the team. And they modified the way they did the psoas release, and it was just such an elegant change. And so we adapted it right away. And you can just feel a little bit more pressure on that psoas when we do it this way. Really nice, Stephanie. Beautiful. Come back in again. So the idea behind this is we're trying to get that psoas muscle to let go and release a little bit so she's not under so much pressure back there. Take her back into a little bit more extension. I think she has a little bit more to give us. Yeah, there it is right there. Now drop her down. There you go. There you go. Very good. Down a little bit more. There you go. Good. Come back up again for me.
Definitely feeling more loose.
Yeah, you feel it let go a little bit?
Yeah.
Yeah. So go ahead. Let's go again. And Angela, go ahead all the way out. So we're lengthening the muscle from both directions, top and bottom. But I can tell you, Stephanie's doing all the work. Come on back up for me. And one more pass, please. All the way. Go ahead. Take her all the way back into extension. And then drop it down again. Very nice. Keep going down. Keep going down. Very good. Relax. Come back up again for me. Thanks, Steph. That's awesome.
No problem.
On your
Good
back
job.
for me now, okay?
Thank you.
So what I want you to do, Angela, turn this way for me, okay?
Okay.
So I'm going to adjust her low back, and before it's obvious which direction she favors going in, and she favors this side. And I think that was one of the other changes we started to do. We just were very specific on how we adjusted you.
Come back.
And you started to get through that plateau that you developed. Even though you haven't been here very long for the kind of condition you have,
Right.
we felt like when we changed the way we adjusted you, you started to stand up straighter. And it took some of that pressure off that nerve, okay? So I want you to relax for me. And then bring this over. Now, I want you to take a nice deep breath in. Let that loose. Let that go. Look down. Beautiful. On your back for me. And you'll always see us try to adjust the hips too.
Okay.
It takes
Yes.
stress off your hips. Do you like that part? Yeah.
It feels okay.
So for people who've never seen any of our videos, did that hurt at all?
Did it hurt?
Yes, when I adjusted you. No.
No, it
'Cause
doesn't hurt.
I think that's one of the people's biggest fears. Is
That
it
you're
going to
gonna
hurt?
No,
it doesn't hurt,
doesn't
right?
hurt. No. I would think whatever you just did, the thing with the
The
leg
muscle?
pulling, I would think pulling my leg back would hurt, but that doesn't
Doesn't hurt
bother
either.
me at all.
Yeah. But that gets your attention though, doesn't it?
Yeah.
You know I'm there.
Yes.
Relax this, let this leg loose. There you go. Now hands over your head for me, please. And I'm just going to bring her back to the table. Sometimes I adjust the shoulders that way too, but we're going to bring Angela back up. Very nice, Angela.
I did well tonight.
You're doing just fantastic. Let's see if you. So come on over here with me so we can get the lens on you a little bit now.
Okay.
So go ahead and turn and face Liam. No, face Liam. Face the lens.
Oh, okay.
So to me, you're straighter, right?
I'm straighter now.
Yeah, you can see.
I kind of feel a little.
Straighter?
Yes.
Yeah, you can see it. So let's have you bend to the right now again. Just don't bump the window because you're going to go so much further. How's that feel?
That's fine.
Yeah, let's see if that's taking some of the pressure off that nerve. That
Yeah,
way.
see, it
Still there.
just hurt.
Yeah, okay.
Yeah.
So what are we going to do when we go home?
I'm
What
going to
exercises?
do those, the sitting,
Beautiful.
and then the ones pulling the legs up.
Yep. How often should you do those when you're acute like this?
Probably should. What? You mean like 10 times?
The frequency, yes.
Oh, like I should do it twice a day at least. Or,
Okay. So see, this is a great learning experience for me too. So when you get acute like this, if you have the opportunity, you should do them every hour.
Oh, every hour.
Until it calms down.
Oh,
yeah,
okay,
yeah, every
okay.
hour, right? And I like if you're going to, I'd have you start with on your back first. Do 2 sets of 10.
Okay.
Go to a sitting position and do 2 sets of 10 there, right?
Okay.
And then once you get moving through your day, go straight to the chair, 2 sets of 10, right?
Okay.
Right? Okay?
Yes.
You got that? And then when's your next visit with us?
Well, I was going to do tomorrow, but I think I'll do Thursday.
Okay. I'll see you Thursday. If it's really barking at you and you want to come in tomorrow, all you have to do is pick up the phone
Okay.
and say, I'm on my way down.
Okay.
All right?
Yes.
Great. Thanks, Angela. Awesome.
Good job.
If you liked this video, please click the subscribe button and hit the bell below to be notified about our next topic. We have more videos coming up shortly. We will be covering a variety of topics in these videos. Also, don't forget to click on the link below to get our free ebook. See you in the next video.